Hello, my name is Dr. Dave Webster, and this is part of my ongoing video blog series entitled The Travesty of Lack of Access to PET-CT in Ontario. So this is a companion video to one I just released, but if you or anyone you know is being investigated by your physician for a lung nodule or mass, then this becomes a very critical video. And the reason is I don't want you to end up yet another deliberate victim of Cancer Care Ontario McMaster physicians. And so this is a video advising you what you should do. So that previous video is entitled CCO McMaster Actions Will Lead to This Man's Death, and that's on my YouTube channel, and you'll watch that, and I think you'll be definitely convinced something needs to be done. This is an example of a man who, if he'd have had a PET scan at the appropriate time, he almost certainly would have been cured, or at least lived for a very long time, but because of how he had to be treated in Ontario, he now will die, and a very miserable death. And you need to understand that the CCO McMaster physicians, they consider this victim's response simply evidence that their efforts to block PET have been a spectacular success. So here's a lung nodule is less than a centimeter, 3 centimeters. Sorry, this is a little thing here on a chest X-ray that you would normally get, just the shoulders and lungs here. And this is the same thing on a cross-section or CT image here. This is the left lung, and that's the heart there. A lung mass is greater than 3 centimeters. Good example here, and that's the CT. So what I'm going to do is show you a couple of examples to drive home my point. This is the 60-year-old female, history of smoker, and a breast cancer as well. And so she had a bone scan, and part of that we do a crude CT, and incidentally we found this little 11 millimeter finding here. Now it actually only has about a 30 to 40% chance of being malignant, but to her it's cancer till proven otherwise, as you might imagine. So I refer her to a thoracic surgeon, and she says, listen, my life is on hold. I cannot sleep at night, and this is exactly how most people would respond. So we pushed the issue with Cancer Care Ontario, and she did get a PET. So let me show you what happened. Now keep in mind the cutoff value of 2.5 is how we can measure how much sugar is in the cells in this mass here, and that's why FDG has been adopted, because it adds so much extra information besides a CT or an MR. Below 2.5, it's less likely to be cancer. More than 2.5 and more likely. So she gets the PET scan, right? And what you see, you can hardly see it against the background tissue here. We measure the value, it's 0.7. So definitely less than 2.5. And what that tells us is now there's only less than a 5% chance of it being malignant. This lady does not need a biopsy. And in Ontario, remember, to get a PET scan, you have to have the biopsy first. But in addition, we now know that this can be followed conservatively with just, serial images, and if it's getting larger or more aggressive uptake of sugar, then yes, we would need to investigate it. Now, in the rare chance it turns out to actually be a cancer, the 0.7 also tells us this is not an aggressive cancer, and even if picked up later, she should do very well. So she goes from my life is on hold, I can't sleep at night, to an exponential decrease in her levels of stress. But 99.9% of the patients in the province are stuck here because they live here. And I can assure you, these people may be many things from Cancer Care Ontario McMaster University, but they are not idiots. They are absolutely fully aware of this exponential increase in stress because of the standards we are forced to practice on you, and what this causes, the stress and so on to patients, and the fact that the delay, like for that 63-year-old male, it may be too late and they'll end up dying. That is not their concern. So here's another case. Now we've got a true lung mass. It's 5 centimeters, and keep this value in mind. We do the PET, and it shows us a couple of things. You can see how strong this is. So this patient is going to need a biopsy. But one of the things we'll see in a later case is there's not uniform uptake. That's uniform on CT, so that they have no ability on the CT to know where to put that needle. But you can see here, if you put it here, maybe it's not going to be such a good news or a good result unless you put it there. So, but also the extra value, it's 12.7 now. Now, what we know from that is it has a 90 to 95% or greater chance of being malignant. But in addition, this high value tells us this is an aggressive cancer with a poor prognosis, no matter how early you detect it, and therefore the physicians from day one need to know they need to be aggressive in how they approach that if they hope to get anywhere at all. So here's another example. This is an 83-year-old female, and it's no question she has lung cancer and she has lots of spread to other places in her body, but the reality is we still need to get tissue, her oncologist, so they can determine if there's any therapies they can offer as palliative therapy and the best thing they could offer to try and prolong some reasonable life for her. So she, of course, living in Ontario, has to have the biopsy, and this is just the cross-section of the CT. This is actually her back and her stomach. She's lying on her stomach. This is her hand here, the right lung here. So this is where the biopsy was taken, from this spot here. Now, during that procedure, another uncommon thing happened. You punctured a lung, it collapsed. In this case, it collapsed sufficiently that she needed what is called a chest tube inserted. So this is what she now had to go through in the middle of all of this. You can see here they have to stick this clamp in here to spread things out, and again they're going to put a tube in there, and then that tube will be hooked up to this suction device. And she ended up in the ICU actually for a couple of days, and then on a regular bed to recover and have all that air pulled out of her chest, and eventually that tube removed, and she spent many weeks recovering. But the bad news for this lady, the biopsy was negative, even in spite of the fact that she has cancer. So how did that happen? Well, here again is that CT. Here's the PET CT done after the biopsy. Remember, you have to do the biopsy first. They simply, this is where the needle came from. This is scar tissue. This is active tumor. A PET is the only way on the planet you can determine where you should put that needle to get the best possible results, okay? But again, this is not the bad news. So here's her scan, and here there's that little thing we biopsied there. But what the heck is that sitting up there? So we do the PET scan. This is her right shoulder, this is her clavicle, trachea, and thyroid. And what is this? Well, that turns out to be cancer, probably almost certainly in what we call a Virchow's node. This is at the left base of the neck, and usually you can't see them, but using an ultrasound, we could have cleared off your kitchen table and we could have got a biopsy. That virtually no risk for that patient, but most importantly for that patient, this could have been done with minimal discomfort and stress that when this patient is already terribly worried about having cancer. So she never should have had that lung biopsy. We could have biopsied here and the whole thing would have been solved right then. We'd have had tissue. We knew she was stage 4. We could have proceeded immediately with treatment. Now, so well, would you want this to happen to your grandmother? Well, I can assure you that McMaster and McMaster here and Cancer Care Ontario physicians, they do know this is the case, remember, and they've been forcing us to do this to patients like this grandmother for now some 20 years. So that if you do have a lung nodule being masked, what I would suggest firstly is ask your physician for a PET CT. You do not need a CT. It sounds like I'm saying there's no use for CT. There are absolutely critical uses, and I'll have another video about that, but don't be surprised if your physician doesn't agree to having one done. And there are several reasons. One of them is that even physicians who use PET routinely, because of the Cancer Care Ontario, people have done such a great job at disinformation that most that are using it don't realize they're using it for the exact opposite reasons that the rest of the world use it. Secondly, sometimes there's just pure ignorance. I've had patients tell me, well, the doctor said it's not useful, it has too many false positives. That's just sheer ignorance. But an important reason, I assure you, happens routinely is your physician might want the test, but they do not want to incur the wrath of Cancer Care Ontario or their own College of Physicians and Surgeons for you daring to stand up for your patients and resist the cancer care standards of care, which are based on recommendations from the mid-1990s. But if they're willing to apply for the PET CT, they're going to have to go through PET Access. And remember, this is a CCO committee also dedicated to blocking PET. So I would suggest they contact me with this. There's my email address, and I will tell them how to do this and how to make sure you will not take no for an answer on that. And there's a case of mine again in my video about my own personal case, which I entitled "Will Cancer Care Ontario Force Me to Assault My Own Patient?" So if your physician won't apply for PET or you get turned down by PET Access, you really should seriously consider leaving Ontario and finding help in a province elsewhere where they actually think patients are worthy of having access to this kind of world standard of investigation and management. And if PET Access turns you down, then I would strongly suggest you contact me. I will deal with these people, I assure you. Now you have to remember that Ontario politicians are the only politicians on the planet that directed their own medical experts to do whatever was necessary, including what you're seeing, to discredit and block PET because they didn't want to pay for it, plain and simple. Now, if all else fails, get a lawyer immediately and have them contact me, and I'll give you all the documents that you need. So, if you do have a lung mass, and don't let yourself or loved one become the next deliberate victim like the 63-year-old male with lung cancer because of the efforts of these people from Cancer Care Ontario. This is the example here. By the time that his physicians were allowed to actually properly investigate this patient, it was too late, and this was 100% due to the direct actions of Cancer Care Ontario and McMaster physicians and the influence they have on critical healthcare decisions in this province. I need you to use social media. That's the only way we're going to be able to force the government to actually stop this egregious and unconscionable assault on patients. And please like the things on Facebook, whatever it is. We need to get this information out as widely as possible. Thanks, and do what you can.